Hello everyone, and thanks for joining me live tonight. I'm just going to wait for a few more people to pop on and then we'll get started. I'm just having a little laugh to myself because the marvels of modern technology are that I did actually start bang on time and my internet dropped out, so I'm now on my 4G and hopefully this will hold secure and you won't lose me. If you have any questions or comments or anything you want to know about dentistry, wellbeing or holistic dentistry, feel free to reach out to me and put comments in the chat box, and we'll use them for future topics for Facebook Lives. So just while we're waiting for people to pop on, I'm going to introduce myself. My name is Dr. Rachel Hall. I'm the founder and principal dentist at Evolve Dental Healing in Kenmore, which is a small suburb of Brisbane. Now, I've been a dentist for 25 years. I graduated back in 1992, which seems an absolute eon ago, but also that time's gone very quickly. Now, when I graduated, I was trained conventionally and I worked as a National Health Service dentist for 8 years, as I was born, bred and raised in the UK. We were seeing about 40 patients a day, churning out dentistry, really exhausting, quite hard to work that way. I was placing a lot of amalgam mercury fillings and just doing what I was trained. And it was when I moved to Brisbane for a change of lifestyle that I found myself in a holistic practice. And this is where I developed my passion for holistic dentistry, and I've worked that way for the last 16 years. For the previous 12 years, I've had my own business, and I've learned a lot during that time about myself, about human nature, people, health and well-being, and also about dentistry. And I feel it's a real great opportunity to be able to share a little bit of my knowledge. And I'm going to start with some of my story and my background. So when I worked for the holistic practice, they were great people and I really liked them and I enjoyed working there. So seeing as they wanted me to work a certain way, I was happy to do that. But what I realised in about 6 months to a year is that my own health and energy levels and well-being had started to improve because I wasn't handling so much mercury fillings. I also saw changes in my patients that I couldn't really explain, and I'd be saying to them, what is it you've done? What's changed? You're looking really well and your health's improved. Tell me a little bit more about that. And their answer would be very commonly, you removed my mercury fillings. And I was quite surprised and a bit taken aback by that. And I was like, surely there's more. And they're like, no, you removed my mercury fillings. And we were doing that in a way that was following safe guidelines and protocols to protect the patient from mercury exposure and to protect myself and my team as well. Lovely to see some people joining. Hello Monica, all the way from Germany. Hello Yasmin, thank you for joining me this evening. So that change in people's well-being and in my own, which I couldn't explain because I hadn't changed my lifestyle. I was still working very hard, long hours. I was still exercising to extremes. I wasn't really taking great care of myself, even though at the time, if you'd have asked me, I'd have thought I was healthy. Yet I looked back and I was drinking a lot of coffee to keep me going. So I started to put some of the pieces of the puzzle together and go, could there be more to this way of doing dentistry than I've given consideration? So during that time, I started reading about mercury and its impacts on health and well-being, fluoride, diet, nutrition, sleep, relationships, stresses, environmental toxins, chemicals, and the energy that we store within our body. And it all started to make sense to me. And the more I researched about dental amalgam, the more I was convinced that I shouldn't be using it and that holistic dentistry was the way for me. So what is holistic dentistry? Well, essentially, if you walked into my practice, it looks pretty much like any other dental office that you'd be in out there. It's got chairs, it's got drills, yes, I know, and all those dreaded instruments that seem to make people nervous. And so from the outside, it looks like we're doing the same thing. We're doing hygiene appointments, we're doing checkups, we do x-rays, take photographs, we do diagnostics, we remove decay, we fill teeth, we rebuild teeth, and so forth. But it's our philosophy that's different, because we believe that your mouth and your body's connected, which it is. I mean, it's part of the same thing. You can't say that your heart is a separate piece of your body, because it's not. So what goes on in your mouth has an impact on your overall health, and vice versa. And we feel as holistic dentists, it's our role to explore that and help you and us understand why we get tooth decay, why we get gum disease, why, if our overall health is bad, our dental health will be bad, and what impact having dental decay, gum disease, infections, inflammation, misaligned bite, jaw problems and breathing problems can have on the rest of the body. And by exploring these avenues, we can create a prevention package for people. We can help them to make changes in their health and well-being so that they're empowered to look after themselves and take better care of their health, as well as teaching them about the fundamentals and basics of looking after their teeth. So when I graduated, I was told, if you don't brush and floss and you eat too much sugar, you're going to get tooth decay. And I think everybody, if you ask them what causes tooth decay, would say sugar, and that's a common agreement. But it seems that there's more than that. And so I'm going to go into that in a little bit more detail. But if you're enjoying what I'm sharing so far, then please press the hearts button, give us some love. Facebook likes that. And if you want to, I'd really appreciate you sharing this so that more people can hear the message. So one of the fundamentals is that you taught sugar, lack of flossing, lack of brushing, tooth decay. Yet what I was seeing was patients who had really clean mouths coming in with a new cavity, coming in with yet more decay, coming in with problems, and we just couldn't make sense of it. We'd look at their diet, look at what they were eating, look for hidden sugars, even looking for acids, soft drink, anything that was causing erosion like reflux, and so forth. And we just couldn't put the pieces of the puzzle together. Then we started looking at areas in their life like their sleep, their stress levels, what their background was. Had they been exposed to chemicals and heavy metals in their lifetime, and that sort of thing. And what we realised is that people with high stress and high exposure to toxins were much more prone to tooth decay and gum disease, despite the fact that they were cleaning well and doing all the things that they were told they were supposed to do to prevent cavities. So it made me appreciate that changes in our health and well-being, our stress levels, are impacting on our dental disease, and that it must mean that if that's going on, our dental disease is impacting on our body. So if we've got poor dental health, if you've got broken, decayed teeth, sore mouth, it's going to make it hard for you to chew. It makes it difficult for you to smile and be social. It can be embarrassing and painful. And so when we don't eat the right sort of foods, that will impact on our nutritional status, and we end up being malnourished. But also being malnourished, which is what we have with our current modern day diets, which is called the Standard American Diet, or SAD, which really sums it up well, is that we're eating a lot of refined and processed foods, we're having too much carbohydrate, we're not getting enough vital nutrients, optimal minerals and good fats to take those things where they need to go. So even though we're ingesting a lot of calories, we're not getting nutrition. So we can have people who are healthy weight or overweight and they're actually malnourished. Now, if you're not getting all the minerals and nutrients and vitamins that your body needs, it's going to start taking it from elsewhere. So if you're low in calcium, magnesium, for example, and your body's acidic because of that, it's going to start drawing those minerals out from your teeth and your bones and into your bloodstream to be able to rebalance things. And if those minerals are being stripped away because you're acidic, that is going to increase your risk for tooth decay. Hi Nathan, lovely to see you here. Hope you've had a lovely day. Thanks for joining. So I was talking about optimal nutrition. And so we talk about in dentistry that you need to get a lot of minerals and fat-soluble vitamins. You need to have enough vitamin D. And so we realised that patients who were low in vitamin D were far more prone to gum disease and tooth decay. And by exploring these avenues, we can help our patients to rebalance their bodies and reduce their incidence of dental disease. So I see my role more and more these days as being proactive for my patients rather than reactive. So to me, that's about helping them prevent disease, helping them not have problems. So my role is, when I see a new patient, is to thoroughly examine them, work out exactly what's going on, leave no stone unturned in their mouth, check for any disease, any stresses that are going on, and correct those. Then my role going forward is to help that patient not have more dental problems. So we do regular maintenance for their gum health and regular checks to ensure that everything's on track. And we support them to find good GPs, naturopaths and nutritionists if that's the way they want to go. So we have a dual role. We have a role where we're fixing teeth, treating disease, and we have a role where we're educating people. And that's why I want to do this series of Facebook Lives, so that we can start getting the message out and helping people to know what's going on in their mouth, why it's going on, and what they can do about it. Hey Claire, nice to see you. Hope you're still singing and the band's going well. Thanks for joining us. So basically tonight it was just to introduce who I am and a little bit about holistic dentistry. So what we've realised in dentistry, and this is becoming more and more mainstream with research, is that smokers are more prone to dental disease. People who have too much sugar, that's a given. People who drink alcohol will also be more at risk for dental disease and oral cancers. So we understand that our lifestyle impacts on what's going on in our mouth, but also what's going on in our body. But there's also been studies showing that if people have got gum disease and dental disease, they're much more at risk of heart attacks, heart disease, strokes, diabetes, certain types of cancers, having low weight births, premature labours, finding it hard to conceive, and even links to things like Alzheimer's and dementia. So taking care of your mouth goes beyond having fresh breath and a nice smile and being able to chew the foods that you like. Hey Simon, thanks for joining. It goes hand in hand with looking after yourself. So if you want to have a healthy body, you do need to have a healthy mouth. It's also important that if you do have any pre-existing illnesses like diabetes, that your gum health and your dental health is really well maintained, because if you've got gum disease, it's actually really hard for you to regulate your blood sugars, and your diabetes is much harder to manage. So please don't take for granted what's going on in here, and that it's not just for kissing and smiling and talking and singing, that there's far more going on in your mouth. And the mouth to me is a window to the health of the body. By looking around your mouth, I can tell a lot about your health and well-being. I can tell a lot about what's going on and how to support you to better manage that, not just to prevent decay, but to keep you living a long, healthy life. So that's why our tagline, or our business mantra, or the way we think about things, is that we talk about filling years and not filling teeth. So we want to help people fill their years and live a really good, productive, happy, energetic life, and not be just focusing on filling their teeth. So over the next coming weeks, I'm going to be sharing some information about holistic dentistry, about well-being, and just life in general. I like to have a bit of a chat and support people to be healthy. So if you've enjoyed what I've shared so far, then please give us some hearts. Facebook likes that. Please share the video. Also leave some comments in the chat. Ask me some questions and I'll answer those in future Facebooks. So it's very, very great to be able to be here, and I'd like to grow this audience and take this message wider. And I'd like to see what you're interested in and what topics you'd like to know about. So thank you very much for joining me tonight. And if you're watching the replay, thank you very much for taking the time to do so, because we can't always be live at times that suit everybody, and hopefully we've got a bit of an international audience going on. So please share, please watch the replays, join in, leave your comments, and I'll be here at 5:30 Brisbane time every Thursday unless otherwise announced, because I do travel and have lectures and things that I have to attend. But I want to grow this audience, and I want to share with you my 25 years of expertise and knowledge, So thank you very much for joining me. Have a lovely evening, and I look forward to seeing you on Facebook Live again soon. Good night.